look something like this here, and that's fine. We're going to be putting in some boxes in here, I think, to organize a little bit better with this little background. So you may or may not need to take one of these, the electronic cap cart. We're going to set it up next door so we can get show the people. Yes. All right. So we have a particular way that we've been setting up the cart with these black wire catcher things here. In general, like just to be able to keep track of the cables when doing different kinds of things, we will often wear them over our shoulders like so. You do that when you're setting up. Like ideally, like you hear that every time that I set it down, it's scraping against this, so that eventually wears down the wires. So that's why we want to minimize doing that as much as we can. The same is true for it hitting against yourself, but to a lesser extent. But if you're wearing like a big metal belt, then it can wear on the wires more. So you actually really shouldn't do that. So you really have to be thinking about where are the wires touching. The main things you want to be concerned about with the wires is whether the wires are bending or whether or not there is contact of the metal sections at the bottom. So like those are the main things to worry about. And when I mean metal, I'm talking about just the part that's in there that you can see that's like silverish looking. Yeah. That's the part that we have to worry about. So these are already showing some wear, and that's okay. So these are called CMS and DRL. Everything has names and everything has a label for where it should go. We actually have two sets of CMS and DRL. The ones that are flat, like this, are to be used when we're not actually putting the cap on. Let's say a kid refuses the cap. These are the ones we would use, the ones that are flat. CMS and DRL complete the circuit, basically, and so you need to have them on the kid to complete the circuit. Otherwise, they normally go into the cap itself. But if they don't have the cap, then we use these flat ones. But then normally we have these that look basically the same, except the only difference is that these have what we sometimes talk about as like buttons. They have the buttons at the end. They're the electrodes that stick out. Same kind of thing. They've got these metal tips. You want to make sure that the wires aren't bent too much. Okay, so we'll be putting this here. And this is how you like set up the cart before they're even here. Like their family's not arrived yet. I'm failing it. So I gotta do the setup properly. All right. Normally you wouldn't have it hanging off the edge. You would just put it right here. But we're about to take all these off. Okay. So I'm not going to do it exactly right. The red ones are for the skin conductance. There we are looking at how much they're sweating. They go on the fingertips, which we will talk about later. So like, like when your headphone wires get like, who has headphones wires anymore? Everyone does wireless ones. But if you have headphone wires and they get tangled, it's the same kind of thing. You have to be careful with them so as not to break it. So like, look at that. Look at that knot right there. That's bad. We don't want that.
This is not, but I can give you an information line to help you find them. Sure. You ready? All right. So it's 1-844-388.
So again, you would normally have it so that they're draped over, so that everything is on the card. I'm just not doing that because we're about to take all this off. Okay, now these ones are the ones that are going to go on the face and the hand. They're all labeled with these numbers that start with EX1 and they go through 1 through 7. There is an 8th one, we just don't use it for our project. So the cart says like which one it is and where it's going to go. So if you look, it says right mastoid, and this one says left mastoid. Those are the bones that are behind the ear. And then you see ones that say left eye corner. That's EX3. That's going to go right here. And then you have right eye corner. It's going to go right here. And then we have underneath the eye where it says lower eye. That means like the upper cheek area. And there's going to be one on both sides. This is pretty standard in most EEG setups, regardless of what system you're using, whether you're here or you're somewhere else.
No, it's okay. I had to print them out anyways.
Do all this.
But for some reason,
All right, 6 and 1. And the truth is, I don't know why I'm moving kind of slow today, but you don't have to do it this slowly.
Okay.
Okay. All right. So another thing that you can do, I normally do this as soon as the participant actually arrives, but not before they get here because we don't want to waste stuff, is to fill up these syringes with gel, which we're going to use for a couple of different things, mainly to fill the cap. There is actually a technique to how to do this. You want to try to avoid putting air bubbles into here if you can. So the way in which to do that is to put it at a tilt.
Okay.
And to kind of turn it as you go once it gets to a certain amount. Once you really see that it's sort of filled all the way around, then you can start to turn it a little bit. And you can see that I've actually been able to get a lot of gel in there, and there's just mainly one air bubble at the top and a little one at the bottom. So that's what you want to do there. Makes sense?
Yeah.
Because of how the air bubbles work, it's very often the case that a little bit of the gel will come out like before you're actually like ready, just because it's pressurizing or whatever. I normally fill up 2. That allows the process to go faster because the person who is in the RA room and the parent person are going to do it together. That's part of why all the RA people like yourself are getting trained to do it. So you're going to be doing it. Okay, the other thing you can do before people come, or really, again, as soon as they arrive, is you can put the stickers on to the electrodes that are going to be attached to the body. So this is for EX1 through EX7. We've got these little strips like this. You pull them off by picking up the blue tab here. These are sticky on both sides. So now that I've pulled it off, it's going to be sticky on this side. And I'm going to put that on the electrode like so. So that you can see the metal part at the bottom. I'm losing track of which side is the sticky side. So like this is a pretty good job of what it should look like. The blue part is angled down, aligned with the rest of the wire. You can see that, right? And you get a pretty good, the circle does a pretty good job of like not covering the metal part.
Okay.
All right. Miranda, if you want to help do some of the stickers, we can do this a little bit more efficiently. That would be great.
Sure.
Team effort.
Yeah, I cleaned them all this morning. That one is still super wonky.
Which one? Oh, the FZ, that one. I thought we were using a different cable now. Or we're not
Oh,
using-
are we? Did they prove that?
I don't know. Okay. Yeah, so when you're putting those in there, you see how like now it's got a bit of a bend in it?
Yeah.
You don't want to push it in. You want to kind of slide it in
Okay.
like this, as opposed to forcing it in, because then you're just bending the wire. It's not a big deal. You can just flatten it back out. See?
Yes.
Okay. So at this point, we've got pretty much everything ready to go on the cart. These would be lined up a little bit nicer. I normally put the hanging wires on the second shelf just so that they're not like dragging on the floor, but we're about to take all of it off. Okay, so Miranda is going to be our child. Oh boy. So the first thing that we do is we introduce them to Archie. This is so that they're not as freaked out by having the cap and all that stuff on them. So you say, hey, are you ready to be a kid scientist? You say it less cheesy than that, but maybe almost that cheesy. And then you show them Archie and say, this is Archie. he helps us out with our project. What do you notice about Archie that's different than maybe other stuffed animals you've seen before?
He's wearing a hat.
Yeah, so most of them will
Wearing a
comment on the
sweatshirt.
clothes, yeah. And then you should just point out, like, he's got this nice belt here, and he's got this cool cap, and he's got some stickers on. And we're going to set you up with the same thing so you can help us be good scientists. And then you can let them have Archie. The parent is going to be in here for this, and, so part of this is to help make sure that they're cool with the procedures, but also so that they can help keep their kid calm and all that good stuff, too. All right, so the first thing that we do is we do the respiration belt. I will often ask the parents to help by holding the back of the belt. It's much easier to do this with two people, actually. So if you want, Miranda, you can put your hands up. So normally what we say is we say, like, put your hands up as high as you can go, try to touch the ceiling. And if you want, you can take the behind Miranda. And you want to go underneath the armpits. We're pretty high up on the chest. I'm not going to do it exactly how we would do it because I respect Miranda's space. But you want to have it so that it's tight enough that it's not going to fall off. And
This won't fall anyway.
yeah, and the black part that is underneath her arm should be in front. Do you want to show the camera so they can see? So that's about where it should be. It's pretty high up. And you want it to be relatively tight. Not so tight that the kids can't breathe, obviously.
I
So-
figure it's kind of like a dog's collar. As long as you put like a few fingers in there.
Yeah.
It should be okay.
That's a good call. All right, so now already they're like, the kids have a wire on them, so you want to be careful with it. You, at this point, can tell them to sit down. Hopefully you've already told them to use the bathroom and everything, otherwise we could be in trouble a little bit later. So normally this actually like requires some logistics, like they're not going to necessarily scoot themselves in. You want them to be pretty close to the table, if you can, while like not tripping on this.
Have a bigger chair.
Yeah, you can have a bigger chair.
Sorry.
Okay, cool. Okay, so, at this point, you could, if you want, hook this up to the box. We're still kind of sorting out exactly how we're going to be doing this, but everything eventually is going to get plugged into here. Everything, again, is labeled. So this one is for respiration, for how much the kid's breathing, and so the one that says respiration on it, RESP, that's where this is going to go. They all have sort of like a guide on them. Towards the bottom, there's like it looks like it's not a perfect circle, and that tells you how to plug it in. So you just match up the guide with the bottom of the place where you can insert them here, like so. Did you see that? It's just like that at the bottom. You can line it up there. There is like only one way to plug it in, is basically what that's all about. Okay. So at this point, one of the things that we need to do is we need to measure our kid's head so that we get the right sized cap. This doesn't have to be an exact measurement. What we're going for is basically a little bit between the eyebrows, a little bit above the eyes, towards the back of the head. If you are watching this, or you could do this right now, there's a part of your skull that kind of dips backwards where it sort of like starts to go down to your neck. Everybody has that. Some more pronounced than others, but it's sort of like the skull kind of like dips back in. So you want to go underneath that where it dips back in. And that's going to be one direction. And then the other direction is to go around the head circumference-wise, and that's we want to just take the biggest possible measure that we can get. So here you'll see I'm kind of going between the eyes, I'm going to the back. We use centimeters. I'm finding that location. It's about like 36, 34 centimeters.
You can feel my head if you want. It's like right here.
Yeah, it's about there. It was about 36.
Nugget.
Yeah. Once you do this enough, you can definitely notice it on people. All right, so this is about the widest point around her head. So, like, Miranda is like a 54. She's an adult. But the truth is, like, just like how like the human body develops, a lot of the head is normally larger than the rest of the body, right? As when kids are little, and they kind of grow into their heads a bit. So they all have a range on them. So like this one is 52 to 56. It's a medium small cap. So I think Miranda will probably be pretty comfortable with this. It does have a lot of hair though, so maybe not. When you're putting this on, there is a front. The front is where it says F. F's are in the front for frontal. So FP1, FP2 are the ones that are in the very front. The ones that are O are going to be in the back. When you're putting it on, you can sort of normally just sort of stretch it front to back. As you're doing that, one thing you want to be conscious of is that these straps are sort of Velcro and they can get stuck to people's hair. And so you want to make sure not to do that.
Really?
Yeah, you might be more comfortable that way. So you can kind of tuck your hair in. If the kids are wearing glasses, you're probably going to keep the glasses on because they need to be able to see the screen and everything. So ideally, we want to be able to close the chin strap. If we can't, that's okay. It's not ideal, but we could probably get a recording like this. It would be pretty decent. So you want to ask the kid to look at you at this point, and that's so that you can make sure that it's aligned. So if you see it's a little bit lopsided, I always tend to default and pull it more towards the side where I'm standing. So that means I need to pour more on this side to kind of get it more aligned. That's actually pretty good. So if you see FP1 and FP2 are kind of like above Miranda's eyes.
Yeah.
Okay, so at this point, we could secure the chin strap, but we're not going to. I messed up the order of something. We should have done the mastoids. Whoops. So hold on, take a half step back. So we also would measure just to make sure that it's in the right place. So when we went in this direction, I said it was like 34 or so. Well, you're looking to take that, you want to take that number, divide it by 2, and that's where you want CZ to be. Approximately there would be ideal. So we're pretty close. If anything, we need to pull it back a little bit more. So that's fine.
Yeah.
All right, so actually the truth is before we put on the cap, we want to do the electrodes that go behind the ears because it's really hard to get them on underneath the cap. You fill up, use a little bit of gel just to kind of cover the metal part. You do that using the syringe, but you don't use the syringe to actually touch the metal piece. You just kind of squirt it out without rubbing the metal on there. So this one's a little bit too much. This is an example of about the appropriate amount to use. I don't know if you'll be able to see this on the video, but we'll put it right there. That's about the appropriate amount to use. So this is EX2. It's the one that's supposed to go behind the right ear. So we're going to sneak this underneath. It's much easier to do this without the cap on. So when you're talking to the kids, say I'm going to put a sticker just like a normal sticker, except it might be a little bit cold in the middle. You want to try not to get any hair in if you can. So I'm not going to place it exactly where it should be just because I don't want to get too much of Miranda's hair. Because again, we like Miranda. It's fine. We don't want to. Miranda has to do this all the time. Hopefully not anymore after we do this video. Okay, so you can take your EX2 and you can plug it into the box. That's for the right mastoid. Then we're going to do the other side. It's going to be the left mastoid. So what you're looking for when you put these mastoid electrodes on, there's a bone right behind the ear. Again, if you're watching this, you can just touch right behind your ear, and there's a hard bone right there. That's what you're looking for. Oftentimes, people will have a little bit of hair there, and so it's really hard to get these on without catching some hair. Just try to get as little as you can. All right, so EX1 is for the left, EX2 is for the right, and then you plug them into the box. Okay, so at this point, now we would really do the cap. Then you want to take your syringe with gel, and you're going to fill up the cap. Again, we would obviously want to secure it. It's a good idea too. For the kids, we have this extra, these sort of like soft strips that we can put underneath so it's less itchy. You can actually fill up the cap without having secured the chin strap, but if you really want to make sure everything's staying in place, it's good if you can get it on early. I like to start from the front to the back. Doesn't really matter. Normally, the research assistant will do one side, doesn't matter which, and the parent person will do the other side. You do not have to scrape their scalp. You just kind of put the syringe into the hole and squeeze a little bit out. You want to squeeze it out until you see it start to come out of the hole. That is how you know that you've put enough in. And just tell the kid that they might feel it. But you notice I'm not putting any pressure on her head at all. I'm not moving her head one way to the other. I'm really trying barely to like touch her head as I put in the gel. Later on, we're going to have to press on her head when we put the rest of the electrodes in. So the amount of gel that you need is going to vary depending on how much hair and the type of hair that the kid has. But very often we will go through 2 syringe fulls, which is part of why it's nice to have a second person. There is such a thing as too much gel. You don't want to use so much gel that the gel starts to overlap and go from one electrode to the other, because what you're doing then is you're allowing the signal that should be only at one location to get mixed in with the signal from another location, and so that's not good. That can make things look really funky. So don't go too crazy. If you don't use enough gel, the program will kind of tell you that, and which we'll look at later. And if everything looks messed up, there's a good chance that either something's not plugged in, or you don't have enough gel in CMS and DRL, which are 2 locations on the cap that we talked about a little bit before.
Or on the arm if you're doing that.
Yep.
So there's
Right.
a cap.
So we were also mentioning before that if you're not using the cap, CMS and DRL are on the arm instead to help complete the circuit. And yeah, same thing applies there. If there's something, if everything looks wonky, although it's harder to tell when not using the cap, that's where you want to look. All right, so I always get a little bit of gel on my finger when I'm doing this because I wipe off the excess as I go. So I'm just going to get the towel. All right, so at this point, we've gelled the cap. If you're really trying to save some time, maybe the other person who's helping with setup will start to do some of the stuff on the hand. But I like to try to delay putting electrodes on the kid's hand and face as long as possible, because that tends to be the most aversive to the child.
Do you want me to start up the program?
I don't know if we're really going to do the task, though, are we?
I don't know.
We can, sure. Let's do it.
Yay.
Okay, so you can see that these are caught. That happens a lot. So you just kind of go up and down, and they eventually kind of work themselves apart. There, you'll see one has red on the side. That kind of tells you which way it needs to be plugged into the box. When you look at the box, you can see that there is a red strip on the side. So the red strip on the cable is the one that you're going to end up lining up with the box. Like this, the red from this is going to be on the same side as the red from that. At this point, I'm going to put this up here, just because I want to have easier access to it. So the thing that we've been doing lately is to have the box up top. You don't have to plug this in yet, but it's going to eventually be plugged in this way. The red's lined up. So if you want, you can take half.
Right.
The evens are for the left side, and the evens are for the right side, and the odds are for the left side.
Okay.
So, they're numbered. So that's what I'm talking about when I say that. I like to start from the back and work our way towards the front. The ones that are towards the center are the ones that are in the back. So if you find your center ones are going to be here. These are your center ones. Yeah, those are going to be towards the back of the brain. And you just match them up like with the letter and with the number that's there. So like this is O1, this is OZ, and you just kind of push them in. This will kind of move the kid's head. Some of the kids will really try to lean away from you, and you can put a finger here to kind of just help them avoid moving forward, away from you. It doesn't hurt. They're just not used to the sensation of somebody kind of pushing on head. You don't have to use a lot of force though. It's pretty easy to get these to go in. The main thing is just not to bend them. The wires as much as you can. They're obviously going to bend some. What I like to do is I like to have the red part of the wire facing towards the back and down. That's the orientation because the wires are going to be plugged in this way, so you want to have them pointed down and towards the back. It's the general rule of thumb. And with 2 people, you can actually do this like pretty quickly, which is great.
It doesn't hurt random.
Oh, no, not at all. So you can just tell them like it's a little bit of pressure.
But again, these electrodes themselves aren't actually even touching the scalp.
Oh, okay.
They're just resting inside the cap. So like
Yeah, the gel is what connects them.
the gel is exactly. That's makes everything work.
Interesting.
Okay. So now I'm plugging this into the box back here, lining up those 2 reds. This kind of clip is called a butterfly clip. You know that you've pushed it insufficiently when the white, clearish metal parts are sticking up.
Mm-hmm.
And to pop it out, you just push both of those down, and it will kind of release it that way. The way in which the wire is positioned is actually sort of intentional. It seems like a silly thing, but it's kind of on purpose. We want all of the cables to really not be touching the CMS and DRL cable. So most of the cables you'll see I'm going to have kind of going this way. CMS and DRL I'm going to have go this way. So it'll make more sense when we got everything on. So now at this point we could do CMS and DRL because they are also button ones that go in the cap. It's the same kind of thing. Although I've been kind of waiting to plug this in until later on so that I have more control over where the cable goes.
Okay.
But you can put these in the cap now. Same things. Okay, so now at this point we would do the ones on the fingers. Before they've come in, I normally have a couple of pieces of tape ripped, which I forgot about. Let's see, we have tape here. So we use this kind of tape here. There's a technique to it. Take your piece of tape, and then you fold the end over a little bit to make kind of like a tag that's not sticky on both sides. Like emphasis is not sticky, because it makes it easier to pull off. You're going to want 4 of those.
Okay.
You want to make one?
Sure.
You want them to be big enough that you're going to be able to wrap it around their fingers a couple of times. But that's perfect for the tag. Nice. And then you can kind of just like put them on the side of the cart to keep them. Yeah, that's perfect. Alright. So these are the ones that are for that are for sweat. They use a different gel. It's in this white container. You fill it up just like you would any of the other ones, not touching the metal itself. And then it doesn't matter which one goes on, but you're going to aim for putting them on these 2 fingers. You ask the person who, either the mom or the child assessor, like, is the person a righty or a lefty? Because we want them to be able to use their dominant hand. So what we're going to do, Miranda's left. The kids are going to have trouble knowing which way you want their hand. You want it palm up. So sometimes you have to show them what that means. Okay, so now we're doing the fingers. And we wrap the tape around, otherwise they don't stay on. When you're putting these on, they're supposed to be on the tips of the fingers, so they go like here and here. How's that, Miranda?
You're good.
Okay. And then I tell the kids that we're going to give their fingers a hug. You're going to tape the 2 fingers together. you're going to kind of run this down their arm a little bit. Doesn't really matter. It has the same kind of thing where there's only one way you can push it into the box. It's got this little knob, this little notch at the bottom. You line up the notch, you push it in that way. Then we're going to do EX7, which is for heart rate. It's the same kind of thing as before. You have a little bit of gel on the electrode itself. That's probably a little too much. Then you take the white part off, and now it's going to be sticky on both sides. And you put this kind of on the wrist where the pulse would be. The heart is a very large signal, so the exact positioning doesn't, I don't think it's so critical because the heart is such a big signal. Maybe it is, and I'm wrong, and I'm giving people bad advice, but it seems to pop up very strongly, kind of regardless of where we put it. And then I use the last piece of tape to kind of just hold everything down in the arm. You can put it in the mitt if you want. That's the quiet mitt where we have them rest their hands. A lot of the kids don't use it, but it's good if you can get them to do that because then they don't mess with the wires too much. All right, so at this point, we're pretty close to being done. We just need to do a couple on the face. And so it's the same thing as before. Put a little gel on these. Margaret has suggested, and I think this is a really good idea, that saying the word face is like kind of aversive and scary, or saying, oh, I'm going to put this by your eyes, is kind of scary to the kids. So we just say, oh, we're going to put some on your cheek now to make it a little bit less scary. Although at this point, kind of done a lot to them already. So this one that I'm holding is EX3, which is the left eye corner. It's like right here. Again, you want to have the wire pointed backwards. Oftentimes, before I put it on the kids, I will just give them a little tap on the part of their skin where I'm going to put it, just so that they know where to expect it. So I'll go like that on the side, so it's not doesn't freak them out as much. I don't know if that actually helps or not, but that's what I've been doing. So like this one wasn't done great. I don't know which one of you guys, this maybe was me. Not pointing fingers, but you see how there'd be not as much of the metal was exposed. Mm-hmm. So not ideal, but that's okay. I wouldn't redo it unless it was like really, really, really egregious. It doesn't really. I don't think it is. As long as a good portion of it is showing, it's okay. So this is EX4. So EX4 is the right eye corner. Not actually pretty close to Miranda's eye there. You don't have to be that close. It's really just like in the corners. Only two left at this point. Number 5. And number 6, which are the ones that are going to go on the cheeks. Another thing that I feel like is a good idea is like if you're having difficulty with something, and don't voice that because it's just could make the kid nervous for no reason. If there's something going on that you like need to talk about with other staff, that's a little bit different. But don't be like, oh no, I did it wrong. Like that's not going to be very encouraging for the kid. Okay, so this is the one that's on the cheek now. Oftentimes I will ask the kid, does it feel like any of these are coming off? If it feels like something fell off, you should tell Miss or whoever, like whoever's with you. Okay. Sometimes the kids will say that it feels like it's coming off, but it's not. But either way, take their word for it and just, look at it and see if it looks like it's going to fall off or something. All right, so at this point, everything has been plugged in. EX 1 through 7, the respiration, the skin, which is labeled as GSR on here, that's the red one. The ribbon cable's all done. We did everything here. The only thing that hasn't been plugged in yet is CMS and DRL. And as I was mentioning before, we want to try to do this, plug it in so that it's not resting too heavily on any of the wires. So I'm going to kind of pick it up here and carry it through. So you'll notice as it is right now, it's not touching anything, which is great. I'm nowhere near the box. I've actually started to use the glue canister to kind of help me out a little bit with that. I go underneath here, underneath the box, so that I'm really not on any of the wires. And then I'm plugging it in. It's the same kind of thing. There's only one way it can go in. And there we really aren't having too much contact with any of the wires this way, which is good. That's what we want. And turn it just a bit. So we're not quite ready to go. We still have to we still need to plug it in with our fiber optic cable. This one is wound like this because if it's wound tighter than that, it can damage it. So you do want to be careful with this one. I think it's expensive too, so not a good thing to break. It has this extra protective cap on it. I normally put that over here, so I don't lose it. This one has also only one way that it can be put in. Unlike the other ones though, the notch is on the top. Can you see that? There's that little tiny notch there. It's like very hard to see, right?
Yeah.
So you align that with the top. And then the way that it clicks in, there's kind of like this, almost like a spring type mechanism that you can push on and then turn. It kind of catches. At this point, you can turn on the box. This is the red button at the bottom. The big blue button at the bottom. You'll see that a couple of lights are going to come on. There's going to be some green lights that says that the box is being powered, and the blue one should be a solid blue light. If it's blinking, that means that there's something wrong. Probably CMS and DRL are going to be the problem. So you would re-gel those, turn it off, turn it back on, and hopefully that will fix it. Okay, so this is what it should look like. And now we're going to go look next door and see how it looks.
Okay.
You might want to move this a little bit closer to the kid just because, we want to give a little bit of room for them to move without pulling the whole cap off. Hopefully that's good. So the way in which you start this is a little bit confusing. There's a couple buttons to press. Press the one that says start. Now you should see a signal. Okay, so this is good. Something's wrong. Most of the EEG channels are relatively flat with a little bit of bounce. There's something going on with O1, and then I can't even tell what this is that's happening here. So the first thing you want to check is this thing called electrode offsets. You want all of these to be within 50, either minus 50 plus 50, and it says there. So it looks like we have a problem with this one, which is F4. The rest look pretty good, actually. So,
What is this number? Is that just a
great question. So this one down here is for EX8. It's not plugged in, and so that's why it looks like that. That's a good question. So I'm going to go back in and go mess with F4. We're going to put some more gel in there. Hopefully that will fix it. Something's not right today. Let's see what it is.
Did you take a picture of the problem?
I'm recording it. It's live video recording of your brain.
Oh, you can record.
It's a video, yeah, with me talking about what's wrong with it on there. Isn't that weird?
No, but and you can see what's on the screen on
Yeah,
the computer.
yeah, it's doing a screen capture of
Ooh,
the program.
fancy.
Yeah, I forgot already. Stephanie, it's F4, right?
4, yeah.
Okay, I forgot already. So F4 is right here. Doesn't really look like there's anything that odd about how the cable is arranged, so I'm just going to put more gel in there. It looks like it might not have been enough gel. How about now? Is that any better?
Yeah, it's good.
Oh, wow. Okay, so that was that. Let's see. So now F4 is much lower. We'll go back with this. So something is still not right. So down here, that's the heart rate. It's flashing. Huh. Well,
What's wrong?
something just doesn't look quite right. I can't actually tell which one it is because it's so big. The artifact is so large. I can't tell what it is. Everything else looks pretty good. Might be one of the ones that's like on your face. Do any of those feel weird?
No. You can see them on the side of the screen though.
Well, no, it's the thing that the offsets all look normal. It's the actual signal itself. Okay, is it any better? So like this type of noise is an electrical artifact. Like it's not, that's not a rain signal. The fact that they're also the same is another way in which you know there's something up with it. I'm gonna guess that some of them just don't have any gel in it, like at all. That we missed them by accident.
Carolyn is also having trouble with getting her biopacks to connect. Oops, sorry.
Okay, so is that the O one is the one that looks messed up? Figure out what the other one
You want me to shake my head? Pat it?
is. Yeah, you can do that. Sure. Alright. No. Sorry, Miranda.
No, it's all good.
Really. Hey Stephanie, did it go away?
Yeah,
Is the orange one still there?
it's not as big, but
It's still doing that same pattern?
now like other stuff is kind of messed up.
Okay, let's try this one. Yeah, this didn't have enough gel in it either.
It's better than it was before.
Yeah?
Yeah.
How about now?
Nah, that one's messed up. I feel like it messed up everything else because everything isn't as straight.
Oh, it's all worse now?
Yeah. Like the orange is all over the place.
Alright, well, good training video, I guess. I don't know what's going on. Any better?
The rest is good. The F4 is still a little wonky though. But everything else like reset.
Is the F4 the one that's messed up though?
Oh, no, it's FC is the one that's messed up. That could be it. That is a bummer. We should have. I actually see, or did we switch the cable out? You are correct. We did not. Wow. Can you hit stop for me on there? Yeah. Like not on the recording, but like on the actual program. Yeah. Okay, we're gonna try another thing. I'm gonna turn it off. Okay, do you want to hit start again, please? Oh, this is such a bummer. Okay. Let's try running this cable underneath here. Perhaps a little further away from here to the hydraulics. Is that any better?
It's a little bit better for the orange one. It got smaller. Everything else seems to adjusted too.
It's definitely better.
Is the big one supposed to be that big too?
No. I don't know if we're going to be able to like do this today actually to get it good, which is such a bummer. Okay, let's try a few other things back here. Did the purple one go away?
Yes.
It did?
Just gonna YouTube it. Yeah, it's kind of like awfully. It's smaller, but it's like more awfully grid. Everything else is kind of messed up.
How about now?
It's definitely a lot smaller.
Sorry, Miranda.
Okay.
The purple one's good. It was just really good for a second.
How about now?
Now it's bigger again.
How about now?
It's smaller, yeah. It's not perfect, but
So there's something going on at the back here.
every time you move the purple, the gray OC gets bigger also.
Well, yeah, that's because they're near each other.
Oh, okay.
How about now?
It's still big.
Okay.
It's not as big though.
This might just be what we're stuck with today, which stinks. Alright, let me try another thing. Alright, I'm going to go against my better judgment. Mess with this again. Really sorry, Miranda.
Okay.
That. All right, here. Let's try this. How does that look?
The purple is like off the screen now. Actually, the purple's. I can't really. You have to.
It is about time to change this cable out anyways, so it might just be the cable. Because I think Victoria's sake it's like about 100 uses. And with all the participants and all of the practice rounds, I think it's about that. So
Okay, how does it look now?
It definitely looks a lot better.
Yeah.
Purple. The last one.
It's better. It's not good. So what was happening a little bit is, and this is still going on now, is that some of the wires were overlapping on the ribbon cable. So sometimes that can be attributable, because like I said, like when I was talking before, I was saying that like sometimes if some of the wires are touching each other, then they're going to pick up a signal from somewhere else, or they're going to make a circuit, and like that's what this kind of activity is, electrical activity. So this is actually much, much better. So I would guess that if I keep messing with these, we might actually be able to get something sort of decent. Is that any better?
The pink is perfect. The orange is still a little bad.
Yeah. So this is actually good for people who are watching this. This is because so that's almost normal now. The pink one is almost normal. I know the other one is not. But that was mainly just moving the wires on the cap. So yeah, we actually got it looks much, much better than it did before. It's not good, but it's much better than it was before. So I'm just like untangling these and then having them not rest on each other as much as I can. And that seems to be helping a lot. How's it now?
It's still pretty bad.
Okay, well, I was feeling so good for a minute there.
Do you think maybe moving the box down would help?
That's a great question. I'm going to move it closer to you. Let's try that next. That's what I do. Okay, how's this? Way better than before. See, if we only had kids who could be patient and just sit with the cap on while we mess with it for like 45 minutes, every signal would look great. I'm going to try lowering it. Let's see what happens then. Sorry, Miranda.
No, you're good.
Let's see.
I'm sitting on it.
I don't think so. How does it look now?
It's still the same.
Okay, well that didn't do anything. Alright, at least it didn't make it worse.
Is that one like super important?
No, I mean, it just makes it, we can't really tell what's going on.
Oh.
It's not the broken one.
I honestly can't tell. I think it is. Alright, is it gone now?
Yeah, it's a lot better.
Because I took it out.
Oh. It's not like completely gone, but it's basically gone.
Yeah, because it's been removed. So yeah, it is the one that's broken. And so there's probably not much we can do. How about now?
There's a pink one that says. Actually, it looks good.
How about now?
It looked better the other time, but
Yeah.
it's still good.
So what's going on with that one is it needs a lot. It needs help because the electrode part like broke off, right? And so I'm pushing down to make the contact better, to get it closer to your head, and that's when it makes it look better.
It looks
So
like perfect right now. Perfect.
So put some dawn something on my head.
now is it okay?
No.
That's way
I mean,
better
it's
than it was
not,
before.
yeah, it's not bad.
Okay, so we're gonna go with this. Okay, so Miranda, we're gonna go with this for a little bit just so we can get some more stuff captured.
We can always redo it another day too.
Yeah, this is pretty close though. This is pretty close. All right, so this is pretty close to what you want. The only thing is there are some extra jagged lines here and here, down here. That one's the worst. That is not brain activity. That's like that. So you can see the arc is down here. Okay, let's actually stop. Okay. pretty close to what would be good. This is not. The orange down here, those bursts of activity are not what a brain should do. It's picking up something else, so it's bad. And these little bursts aren't great, but we could certainly record from this. Like if a kid looked like this, we would just do it. This is good enough. That's the heart rate down here. Have it with normal. Then you'll start to see, you'll notice some other jumps that are in here. These are normally picking up on things that are going on with Miranda's eyes. Those are blinks, or she's moving some muscles in her face. This one here is when you move your eyes side to side. Okay. So yes, that's side to side. Stuff. She's looking around. If we're actually recording the video, I can see her looking around. Stop smiling, Miranda. So there was a bigger head movement, and so you saw got much easier. Now she's sitting still again and calmed down. So we're just going to look at the electrode offsets for a second. All these are supposed to be within 50 to minus 50, within that range. This one over here, EX8, that's fine. It's not. We don't use EX8, so these actually all look pretty good. Okay, so Miranda, if you wouldn't mind, please pretend for us that you are eating. Okay, so those are that's jaw movement. Okay, so you can stop. So if there's these sudden sort of bursts, and it doesn't even look like the kids moving that much, they might be doing something with their mouth. How about Miranda, just sort of like clench your teeth. So yeah, so good, that's muscle activity in the jaw that's messing everything up. Okay, you can stop. If you wouldn't mind, just don't raise your shoulders, but just tense your shoulders. Or laugh. But that's laughing. That's what laughter looks like.
How do you just tense your shoulders without raising them?
So raise them up. So raise them up. That didn't do too much, right? There's some noise that's in there. It didn't do too much. That's mainly because she's laughing. Okay, Miranda, do a button press. Do another button press. So you're not seeing the button press because she's not doing anything crazy and her body's mostly still. Okay, so Miranda, please press the button with your elbow. So that was a little bit wonkier, but still pretty good, actually. Okay. You're seeing some spikes on FP2. That's the blue one here, and some spikes over here on FP1 and F3. That's because that's just like facial movement stuff that we try to process out. Not much about it. Okay, Miranda, do you want to like move your feet up and down a lot, like you're tapping your leg? You see a little bit. It's a little bit noisier there, and now she's moving her head back and forth. Okay, so Miranda, why don't you just like look where the child person would be, the child examiner. Can you do that again? So you see a little bit of noise from her turning to the side, so we don't want her doing that. Can you lean your head back? Just like look towards the ceiling. So like that's obviously not good. It's a little crazy when she's doing that. You want to do that. Miranda, what are some other common movements that people do? So like that's kind of noisy, whatever that was. Just like moving your hand around. Okay, now let's have. Do you want to pull off one of your eyes? Your eye electrodes. Okay, so did you guys see that yellow that went all crazy for a second? That was the eye falling off. But now you can't really see it so well. There's like these random things going on down here. She's playing with it, so that's why it's showing up. But if it were just to sort of be sitting there, it's not going to necessarily do that, so it's kind of hard to tell. But this sort of suggests that something fell off. Do you want to stick it back on? Do the best you can. And then let's take one of the ears off. So there, it's the same kind of thing, right? You see that burst of activity, and then it kind of just like disappears. So you can't know necessarily from looking at this that it's fallen off unless it keeps moving around. Do that. However, if you went to the electrode offsets, you could see all of a sudden it's like shot at the top, and that's because it fell off. It's going crazy because it's not attached. Now it's back on. Okay, I think that's good enough. So Miranda, you want to just like sit still for a minute? So we can get it to calm down again. So like what you're seeing right now, that's pretty good. It's what it should look like more or less, except for these little spurts here aren't great. Look at how much that's calmed down since we first started. So that's pretty good. And one last thing, Miranda, can you close your eyes for a little bit? So if she does this for long enough, you could start to see some changes in the signal back here. But everything is just kind of calming down a little bit because she's more relaxed, she's more chilled out. You notice you don't see an FP1 and F3, you're not seeing any eye blinks anymore. She's not blinking, her eyes are closed. So the signal really looks a lot cleaner when her eyes are closed. We don't do any tests as they go. It's much more chill. Pretty neat, right? Okay, so we're going to stop that. So cool. Okay, which is the one? Okay, cool. All right, let's get Miranda out of there. Just a really quick thing. This is more for everyone else will do this training too. So we actually haven't recorded anything. Wow, it looks so much better now. Did you take anything off, Miranda?
No.
Your signal looks great now. So weird. The kids almost never look like this because she's an adult. Her brain is totally different. Most of the kids are going to have brain much less That was so much fun.
So much fun.
Great. What a good time. All right, let's get you out of the cab. So we're still recording the main video, but basically you want to just like try to get this off without causing too much pain, but you are pulling the sticker off of skin, so it's not going to like feel too good. Kind of just try to do it fast. How was that, Miranda, actually?
They're fine. No,
Okay.
just try and pull the skin taut, and then
I just lost the blue thing. I'm sorry.
it's all good.
Would you rather take yours off, Miranda, than have me do it?
I don't really care. Always pull from the blue tab.
Yes.
Are you still recording on there?
Yes. We are. Always pull from the blue tab.
And I usually take the cap off first because kids hate it the most.
Okay.
So usually just like peel.
Oh, so you can get the entire thing just off?
Yeah,
without-
exactly. So getting it off is much easier than getting it on.
Alright.
Let me take this. Sorry, I can't see that
Well,
well.
you do. That's why I get your hair.
It's fine.
Oh, I'm so sorry.
No, me, I have hair in my butt.
All right, so we're going to take the fiber optic cable off too.
Yeah, technically that should be done first. Fiber optic. So you have to make sure that they stop the program, then you turn off the box, wrap up the fiber optic cable, and then take off the cap and start taking everything else off.
Yep. Then you cover up the fiber optic cable with that little plastic cover that it has that's special just for that.
And try your best to not let the kids take anything off. they'll obviously want to. So
Yeah,
And then
the kids are not going to handle it with care. So we don't really want them to.
Margaret
I wouldn't
usually,
assume so.
Margaret usually has the kids squeeze her fingers while somebody else works on them.
Yeah.
Or if it's whatever, but it's definitely.
Alright. Do you want to take off the respiration belt? Okay, so there is like a whole process to like how to clean these properly, which we can't really video because it's going to be in the other room.
Mm-hmm.
But we are going to go do that now because we can't just like let them be dirty for a long time now.
I'm free. Yeah, the chin strap is the worst part.
That's
Alright, let's walk in out. Okay, so you can like do all of the cleanup without them, right? So normally the parent person will do this when the mom is doing her surveys. So you can basically, the rule of thumb is you have to be careful with the knees.
Base.
You have to be careful with these. You kind of just slide your nail in. But with the cap, you can be basically as rough with it as you want. Cap doesn't really matter as much. It's the wires that have to be more. I mean, like eventually we could beat up these caps so much that they fall apart, but they are so much more durable. I mean, they're made from like stretchy plastic material, right? So that it can be Miranda, would you mind stopping?
Yeah.
Thank you so much for